Thank you, Luis. And I'm going to take this opportunity as well on behalf of myself and my colleagues to wish everyone attending with us today a happy Nursing Week. It's a blessing to be working in this vibrant community and to be able to share experiences and learn from the audience as well. And it's also nice to be able to start this webinar with this powerful theme from the Canadian Nursing Association regarding how nurses make a difference and they change lives. And through innovation and educational influence, they are able to shape tomorrow and provide the highest optimal practice in nursing. With that, I would like us to get to know our audience a little bit. And we have created a couple of just simple poll questions. And please feel free to either respond or decline, whatever you feel like doing. We just want to get a sense of where people are joining from and how familiar are you with ChatGPT. So thanks for responding. Responses are coming in. We'll give it another 30 seconds maybe for people to complete the responses. We have about 90%. Thank you to all who have responded. Luis, you want to show us the results? Or do you want, do you want to show the results or?
The results are sharing right now.
Yeah, because it says stop sharing, but I can't see them displayed, but that is okay. So this is quite interesting. Like we have people coming from different parts of the country with a few individuals and from international settings. And also we see the bulk like feeling like they're a little bit somewhat familiar or not familiar at all. So we hope with this webinar that we will be able to kind of get people to understand the concept of ChatGPT and related aspects of artificial intelligence and digital health in relation to nursing practice, and also kind of provide some demonstration around the use of ChatGPT in the classroom in terms of supporting clinical education and also in general nursing practice. And toward the end, we'll share some opportunities for engagement in digital health because this is not going to be our first time learning about it as the field of AI and large language models continues to evolve. And AI is a broader field of creating machines that can perform tasks typically requiring the human intelligence. And when we mention ChatGPT, also another important concept is the large language models, which is basically an AI system that is specifically designed to generate and understand human-like language. These sims do learn from data that we input into them, and they continue improving their performance over time. And there are different techniques. We don't want to get into that um, technical side of things, but things like machine and deep learnings are part of the techniques associated with these machines learning. And the exciting part about the natural language processing that these large language models can be used to process things like text generation, language translation, sentiment analysis, and text summarization. And these terms have become now so popular because the ChatGPT, which stands for a generative pre-trained transformer, is the language model that has created Caius like 2 years ago and still continues to, and it was developed and trained by OpenAI. What's unique about ChatGPT, it is so conversational and it's so like kind of human-like. It can answer your questions and it can provide you information in instant seconds, like just type in something and it will turn it back to you quickly. It also has the ability to admit its mistakes and also to reject any inappropriate requests that you may ask of it. And it continues learning, and it is based on using large or vast amount of information that comes from different sources. Since its release back in November 2022, there is now the newer version, which is ChatGPT 4, which is a little bit more advanced. And now it requires actually payment to be able to access and use this resource. And it gives you more functionalities like text, image, and audio generation. And the other edition is not as bad. Like it's still like it provides some services, but it is not. It's limited to text generation, and also it is limited in its the quality of the output that it generates. We will dive deeper into these aspects of ChatGPT as we do the demonstrations. But also, it's important to recognize that ChatGPT is the tip of the iceberg. And since this whole business started, we have seen a lot of competition going forward and fiercely. You've heard about probably applications like, the giants companies like Google initially released Bard, now called Gemini. Microsoft released the Bing, the Copilot, and the Claude and Perplexity. And those are just a few examples and many other open source resources out there uh, that still like continue to develop as we speak. Despite the excitement about ChatGPT, there are multiple concerns and challenges that we're still grappling with, like these systems learning from data freely available on the web may there is the risk for misinformation and disinformation and sharing harmful content. Also, because it uses these data from the web, there is the risk for amplifying biases that are already present in our society, like cultural biases and stuff like that. Within the academic settings, like the most maybe mentioned risk in this environment is the potential for dishonesty and the copyright infringement. Also, the risk that this overuse of those tools over time, it may impact thinking and learning by having people like kind of rely on these machines to think on their behalf, and that may eventually impact the decision-making skills and abilities of the users. Also, when these users are our students, that's overall academic development will be impacted. There are also concerns around how these AI tools will affect our environment. And the main maybe challenge here, in my opinion, is with the absence of policy and regulatory frameworks to guide, organizations or industries and embracing large language models and how these are going to affect health professions, whether they are health professions or otherwise. This is still open to debate, and we don't have much guidance in that regard. On the other hand, some educators have seen value in embracing ChatGPT, and they believe that this might actually create some personalized experiences for the learners. Of course, if they are supported through this process, it may help them improve their digital skills, maybe facilitate time management and develop their organizational skills, or help them understand complex concepts that they are learning about in nursing school. Um, we will also hear about those a bit later in the presentation. So universities really acknowledged ChatGPT immediately once it was released. And although maybe the first impression suggests that there are concerns about academic integrity, but universities also are recognizing that, this is a wave of change and an emerging trend that is affecting higher education worldwide. And there is a need to support individual users, including students, administrators, policymakers in these environments, and educators. So it's not only just kind of telling them no, don't use ChatGPT. It is being acknowledged, and resources are being made available to help individuals increase their understanding and familiarity with the ChatGPT. However, let's look at the broader picture here. And you can see that healthcare is going digital, like it or not. And we have already digitalization in our health environments. It's not news to us. But this year, on the World Health Day, the WHO has released another generative AI application. I don't know if you have heard about it or not, but you're welcome to meet Sarah, which is a smart AI resource assistant for health. It engages in dynamic personalized conversations like human, and people can just go in and type questions and get the responses similar to what you get in ChatGPT. And this information is more accurate because it's fed with more credible sources. It's accessible 24 hours and in 8 languages. Imagine how impactful that is reaching broader populations. And that kind of system was developed previously, during the pandemic, because you can also relate to that period when we experienced huge amount of disinformation circulating. So in the context of nursing practice, like nurses can expect that patients will be starting to use such tools and also maybe using the chat GPT. So how does that impact patients and how can we support patients into this process? And lucky that we are able to gain some insights about nurses embracing AI and because this is a very, very recent report just released 2 days ago from Canada Health FOA that shows that nurses are using AI-powered technologies. And although only 6% in this 2023 survey of nurses' use of technology in clinical practice suggests that it is a small proportion. However, it shows the potential of AI in clinical applications that we have. Like, for example, the clinical decision support tools or predictive analytics or creating personalized care plans. And with more digitalization in our health system and more implementation of electronic health records across the country, we anticipate that there will be more integration of AI-based technologies and even maybe different and newer solutions that we probably are not aware of. So digital health is really not a new concept. We have been talking about it a lot in Canadian nursing, and it builds on e-health, which is like some 40 years ago, we have been using technology in healthcare. Now, the digital health kind of provide that umbrella term that encompasses both existing and emerging technologies such as AI, robotics, machine learning, and those are going to maybe look different, and we may even have a different conceptualization of digital health as days go by. In terms of how nurses know, how much nurses know, and how comfortable are they with the digital health technology and AI specifically in this survey, it shows also that nurses are still having limited knowledge about AI. Um, of course, not to generalize, that's a one point in time type of survey. But also the good news is that we have resources, and I would like to mention this resource to you, suggested to you. It is released by the Registered Nurses Association of Ontario, providing best practice guidelines to assist nurses regarding their clinical practice in digitally enabled health environments. And this is a very valuable resource because it's evidence-based, and at the same time, it does also address AI-based technologies. So it's not totally kind of difficult time as we transition because we're kind of building the plane as we're flying it, and there are some resources being developed to support our nurses into this transition. But also we need to think around the future generation of healthcare providers and how should we as a profession, how do we need to adapt to meet those needs and make those decisions around embracing AI in a responsible way through educating our nurses at the undergraduate and graduate levels, providing them with knowledge and resources to develop the competencies they need in the work environment. So they are work ready when they leave our programs. And also, they are more capable of leading the digital health transformation, not only just going and using those tools, because they have to use them. So we need to evolve our competencies, and the competency is important because it does outline the expectation of nurses. And in Canada, we have three major competencies here around nursing informatics and the use of technology that were developed in 2012 by the Canadian Nursing Association in collaboration with Canada Health FOA, providing foundational knowledge for the undergraduate level for educators to provide education in relation to information and knowledge management, professional responsibility, accountability, and use of ICT, which is the information and communication technology, in the delivery of patient care. And as you can see, type of the examples of technologies listed there, they don't really address AI. And most importantly, they don't also take into consideration EDI concepts, for example. And those are important things that we need to incorporate into our thinking about technology. So Kazan is now leading the work around upgrading those competencies, and work is ongoing based on a scoping review that is being conducted by my colleague, Dr. Charlene Shu. And instead of like revamping or discarding those competencies, we're rebuilding them. We're just kind of augmenting them with competencies related to the concepts I mentioned. I encourage you to find the recording of this session that Dr. Shu has provided. It's an excellent session to just get acquainted with the progress in that. Also, I would like to share with you that we also would like to inform our practice as educators based on the best available evidence. And because the field is evolving and we need to have information around how this ChatGPT is being used in our educational settings. So we are now running a study, my colleague, Dr. Laura Vogelsang, and myself, through a funding from Kazan, to understand the state of ChatGPT use among undergraduate students and educators. So we're doing a survey and entry with the educators and environmental scan and also a rapid review. We are already close to completing our data collection, but we would like to take this opportunity to thank all the educators and the students who have contributed to this research, and to invite educators also who are still interested maybe to share their perspectives to scan the QR code you see on the screen or email at anaz@ualberta.ca and express interest in participating in an interview if you would like. So the learning curve is definitely steep, and it is a discovery stage for everyone. Like it or not, it is what it is. And we're still kind of into the stage of thinking around policing or facilitating the learning with ChatGPT. Also, we know that educators know that there are maybe some tools there that they can use to get to recognize or find AI built tools, or if students are using ChatGPT or not. And colleagues at McGill University librarians have developed the robot, which is a simple kind of similar like to the CRAP criteria where you can evaluate AI tools. Also, we're counting on the educators' perspectives and pedagogical knowledge of best practices to inform their practice, and also with the support of institutional guidelines and resources. So it is going to be a long life journey. And I think the key message here is promoting agency and human agency in this context. And through engaging in conversations to critically reflect on the generative AI's impact on teaching and learning, and not only in teaching and learning, also on the future of nursing and the future of healthcare. This would be the first critical step to do, and that's why we are here in this webinar today, to engage with you in these conversations and maybe hear from you around what are some of the challenges you're grappling with. So without further ado, I'm just gonna turn it over to my colleagues, Dr. Ogilsang and Abdurreza, who will walk us through the first demonstration of ChatGPT use within the classroom setting.
Great, thanks, Dr. Klebe. My name's Laura Vogelsang. I'm joining from down in Southern Alberta at the University of Lethbridge, and I'm quite lucky. I get to teach our 3-credit digital health course within our undergraduate nursing curriculum. We're very fortunate to have that course and see how that aligns with the new CASN competency framework, recognizing again the increased need for digital health capacity building and competencies in our undergraduate nursing education. So I'd like to just start with another poll quick, if I may. Just wondering, when you think about integrating ChatGPT in nursing practice, what's your first reaction? So we'll give that about 30 seconds to come in. All right, looks like responses are slowing down, but a nice split here. I'll end the poll, share those results out. So as we can see, a distribution where there's some early adopters who have joined us, are eager to learn more. I'll hopefully be able to show you something you haven't seen yet, some people who are nervous but excited, and then those who are cautiously curious. And by nature of the webinar, not surprising to see lower results in those who are unsure, not interested, but certainly appreciative of those who maybe aren't sure, wanting to join us and learn more today. I like the phrasing cautiously curious. That's something that I really try to integrate within my teaching philosophy of appreciative inquiry around new technologies. So rather than having a really polarized approach to technology saying, you know, it's all good or it's all bad, I really try to approach technology integration with students in ways that they can still have those critical thinking and clinical judgment skills, but then see how technology can help them perhaps become more efficient and effective nurses, and of course, promote better patient outcomes. So I'm gonna stop sharing and close that poll. And if it doesn't close for you, you have that red X up in your top corner. This is just kind of a fun slide that I put together. When we think more high level about artificial intelligence, I know my mind immediately goes to perhaps the RoboCop, Terminator movies, kind of thinking in that way. But really, for those who are maybe not sure about how AI is already maybe ubiquitous in our lives, just some fun examples here. So again, with Alexa or perhaps your Google Home, it could be linked to your thermostat. So already using some of those predictive capabilities, looking at the way that you're conducting yourself and then trying to predict what you would want. I think even Microsoft Outlook is a good example. I know I was joking at our rehearsal that if my calendar crashed, I wouldn't know if I'm coming or going. And I really do rely on that calendar even to sometimes predict events or pull them from my text messages and recognize that I have an appointment. The junk email is a great example of that. Your Outlook is trying to discern based on what you're clicking and your behavior, what emails it thinks you want to see and what you don't want to see. Of course, we know credit cards have fraud protection, and even that Google Translate and Google I'm feeling lucky button is an example of artificial intelligence that maybe you're already using without even realizing that's what it is. Search algorithms are systemically not all the same for everybody. So we could all type the same words into a search engine and perhaps get them ordered in different ways based on our computer trying to figure out what we need. That's actually something we talk about in my digital health course and how that can potentially reinforce that confirmation bias that individuals are looking for and what those impacts can be on health. Next slide, please. All right, so just to kind of refocus us back to ChatGPT, I will start just by letting everyone know that the examples I'm bringing forward that I've had success with in my teaching are from the free version. So something to keep in mind if you're looking more into something complex with that paid version, certainly these will work, but you might even be able to enhance that. This really is for maybe those who are more exploratory, just wanting to try that free version. So we already know that it is that language model, and really it is basically trying to predict the answer that you would most likely want to see, of course, on a really complex basis. So initially the demand was so high, the system was over capacity, and that was certainly something I experienced last year, trying to research and learn more and even do some shorter, less complex presentations about ChatGPT. There were times I was worried I wouldn't be able to get on. Again, the chatbot is trained on a lot of data, websites, books, news articles, and journals, but it's not perfect, especially the free version. I've put an example down there for you. I think we can all universally accept and agree that Queen Elizabeth II did pass away. However, if you ask ChatGPT what happened at Queen Elizabeth's funeral, the free version does not know that that has taken place. So as you can see there, the last knowledge update being January 2022, Queen Elizabeth was still very much alive at that time. So it's not able to provide information around the process of the Queen's funeral. So again, one limitation that I like to highlight for students, again, we know that we emphasize current evidence and best practice in our teaching. So one way that this might not work. However, in ChatGPT 4, the update is more recent in that paid version, so you would be able to see it generate a different response for you. Next slide, please. So this is probably one of my favorite examples. Even in the free version, I think there's a misconception or perception that really all it does is answer back to you quite conversationally and anecdotally in a paragraph format. However, ChatGPT actually can help you generate rubrics, which has been quite helpful for me. As I mentioned already, within the digital health course I teach, there is an academic paper. The students have to essentially analyze a population that may experience digital inequity. So rural populations, older adults are two common examples from the course, and they have to work through describing that complexity, offering recommendations, and looking at contributing factors. So I actually have asked ChatGPT to help me develop the rubric for that based on my marking guide. So as you can see there, I said, can you make me a rubric to grade a university nursing paper about the digital divide? It's not perfect, but it gave me a starting point that easily copy and pastes into a Microsoft Word document. Some key pieces there that I learned through trial and error, really highlighting that it's a nursing paper, that it's at the university level, helps to bring in some of those discussions on patient outcomes, recommendations, and higher level thinking that we'd expect from students. Again, I still had to go through and a lot of tweaking, makes it pretty much look quite different by the time it was student facing. However, it gives that little bit of a breakdown and just some inspiration around wording, etc. Still allocating marks. I had to kind of tease out the different areas I wanted around the analysis and some of those current recommendations, but definitely in a few seconds gave me something to start with that was quite effective to move forward with teaching. Next slide, please. Another thing that I like about ChatGPT is that it can make concept maps for you. My background as a registered nurse is medical surgical nursing, so that's where a lot of my examples and teaching experience comes from. So I asked ChatGPT to make me a concept map for nursing management of sepsis. As you can see, it was able to do that. It is quite a linear concept map, but because again, I had that word nursing management in my question, instead of just saying about sepsis, it kind of followed that natural nursing process about signs and symptoms. So some of our assessments, interventions, and outcomes, which was quite exciting. Whereas if I just asked it to create a concept map about sepsis, I found that it focused quite more on things like the pathophysiology and epidemiology, etc. So ways that I haven't tried this yet, but I'm excited to use this in class. As you can see, it still has a bit of limitation or vagueness to where I would expect sort of that undergraduate nursing student critical thinking level to get. I apologize, the font's a little small, but even in nursing interventions, you can see the second bullet there says fluid resuscitation followed by oxygen therapy. So for me, I see this being an effective way that students can then start to build that concept map out from their skeleton to really get down to what's best practice. So fluid resuscitation, what does that look like? Are we doing crystalloids? Are we doing colloids? Is it hypertonic? Is it isotonic? Is it based on, body weight, or how do we calculate that? And they can start to fill in some of those gaps. Great study tool for students as well as they're reviewing these different disease processes to start to map out their own knowledge. So have ChatGPT start it for them, challenge them to do this as a closed book activity, see how much they can fill in, maybe individually, then bring it to a small group and ultimately a larger group discussion. The students can then potentially leave with a concept map of the disease. Next slide, please. Another way that I've had success, just this past year, I did decide to incorporate 2 closed book exams for digital health nursing, which was quite challenging given how fast it's changing. And in some ways, there is still some subjective philosophies around the way we integrate digital health technology in our teaching. So I've asked it to help me write test questions. I'll give the caveat right now that I never take these verbatim and add them to a closed book exam, but for me, it helps get those creative waves flowing a little bit. Also, when I taught more med-surg focused courses, I think I can speak for a lot of people on the call that students love to do those practice questions and see examples of how the instructor might ask questions or pose ways that they could potentially see it on their registration NCLEX exam when they're done. I'm always hesitant to deplete my test banks by sharing those questions in that open discussion format, because of course, then I can't use that question on an exam. So ChatGPT can be a way to help mitigate some of that demand for practice questions that students might have. They can either, use this again as a study tool and ask ChatGPT to make them a practice exam that they can use for review. Or in my case, I've used it again to help me write those questions. Some ways, again, through trial and error and tips that I want to pass on to you, I find it helpful to specify again that it's a university level question that I'm looking for. I often do say the year, though I can be honest, I don't know that it really pulls a different hierarchy of question for a first year versus a fourth year nursing student, but specifying that it's at that undergraduate university level is great. Again, asking if I want it to be a case study format, an application format, kind of moving again, higher taxonomy than just those memorize and recall questions. One great tip is that you can actually copy and paste content in and ask it to generate a question for you. So if you have perhaps a short excerpt from an assigned reading or textbook, you can actually add that to ChatGPT and it'll generate a question back for you. And if you ask it, it will give you the rationale for the question. It won't provide a citation as to where it found that answer. You might have to go in and manually say, okay, this is from this reading that the student would have been assigned. But when it gives you the question, it will provide a nice anecdotal rationale for the right and wrong answers when prompted or asked to do so. I also think it's funny. I just wanted to note, for some reason, when I talk to ChatGPT, I want to think of it as a person. So you'll even notice that I always say please to ChatGPT, which is kind of an interesting, maybe philosophical thing to draw your attention to, and how we engage with AI and that personification. And it's a habit I haven't seemed to be able to get away from. And I don't know, it's for some reason, I don't want to hurt ChatGPT's feelings or seem like I'm asking it too many questions, which is something I have to reflect on. Next slide, please. This was an in-class activity I implemented last year. It was just a formative assessment for students, but again, really, by the time this evolved, it's only been integrated into my course in the past year. I did want to again bring in some of that appreciative inquiry approach and that recognition around clinical judgment and critical thinking. So I tried to get ChatGPT just to start a conversation around displaying bias or outdated information. I've also used the Queen Elizabeth II example that I put in a few slides previously. In this case, what I did was I asked ChatGPT to generate a story for me about a construction worker and a teacher. historically to professions that are quite gendered, so with a lot of female teachers and male construction workers. And interestingly, within my prompt to ChatGPT, I didn't specify anything related to gender, but it did assume that on its response. So as you can see, the story about the teacher was Mrs. Thompson, and the story about the construction worker was Jate, and it does assume those cisgender male pronouns. So again, then just a way to start some critical thinking questions to students. Is this problematic? If so, why? If so, why not? What do nurses need to know, be, and do in the presence of this potential biased or gendered language that's coming through from ChatGPT? Something else I like to do in my course just to keep it fun. Of course, we're on a learning management system. So prior to the course running every week, new content being posted, students can do online. At the top of my course, there's a little robot character that I get generated by AI, and I have him change every week to be doing some sort of different activity. So during Valentine's Day, a lot of he was in love. On St. Patrick's Day, he was enjoying himself, and during exams, he was studying. And anecdotally, the students said they liked seeing what the robot was up to every week. And again, using AI to generate those images, so those images don't exist anywhere other than in that course. And it's just kind of fun to see that come to life. And that's something I just used again through Canva. Next slide, please.
Thank you, Laura, and thank you all for joining our webinar today. I just want to acknowledge that we have around 170 participants for a 2-hour webinar, which is great. There seems to be a lot of excitement and curiosity about ChatGPT and large language models. So I will continue showcasing potential applications of ChatGPT in classroom teaching using GPT-4, which is the paid version. So it's a great comparison with Laura's content. Our aim is to illustrate how large language models like ChatGPT can be used not just as tools, but as integral components in developing pedagogical frameworks. Our hope is to enhance your digital literacy and empower nurse educators and students to use AI effectively and ethically. So in this example that you see, I wanted to design a classroom activity and assignment with the learning objective of developing critical thinking and decision-making skills for nursing students when facing complex ethical situations. So I gave ChatGPT a scenario of an ethical dilemma a student was facing when caring for a transgender or LGBTQ2S+ patient, and asked ChatGPT to design an activity and assignment. It came up with an interactive case study for critical thinking with a role-playing activity and a 1-page reflection assignment. Next slide, please. So then I was like, that's good, but let's turn that into a game, and told it we are missing a player. So, hey, ChatGPT, can you play the role of the patient or the client? Then it gave me specific instructions for the role-playing game with different rounds and questions for the nurse and other players like family members. And it was much detailed than the GPT 3.5 version that I tried earlier. Next slide, please. Let's look at another example. In this one, my learning objective was for students to understand pharmacology concepts, medication safety, drug interactions, and pharmacokinetics or pharmacodynamics of commonly used drugs. So I asked ChatGPT to design something fun and interactive, and it came up with the activity of a digital escape room of pharmacology lab mystery with an infographic assignment. Please note that because I didn't say it's a nursing course, it automatically assumed that it is a pharmacy or chemistry course that involves a lab. So you can change that by telling ChatGPT that you are teaching a nursing course. It outlined instructions for the activity, which involved dividing students into groups, giving them certain clues about different medications in the lab. Next slide, please. And then asking them in different stages to find out what drug classification we are looking for, their mechanism of action, their safety checks, and what drug interactions may be present, how the drug is absorbed and excreted from the body. Then ask students to solve this puzzle, synthesize the information, and create a final group infographic. So by the end of this activity or assignment, you would have different groups of students creating infographics on different drug categories like chemotherapy drugs, analgesics, antibiotics, etc. Next slide, please. So if we start to incorporate generative AI and large language models in classroom teaching, how does that impact trust in teacher-student relationship? Here's an interesting article about a student's assessment experience. So students were concerned that they may be wrongly accused of AI cheating. One student mentioned, "I'm scared, so I turn off all AI tools when I do my assignments." They were concerned to face potential penalties from teachers if they admitted to using generative AI for their assignments. They feared that teachers who don't know them personally may assume the worst of them. Their fear of negative outcomes created barriers to open communication and willingness to take risks, which is crucial in developing trust. So this lack of trust was due to a one-way transparency regarding the use of generative AI. The students in the study were required to openly acknowledge any AI assistant, submit chat records for accountability purposes, but the same level of transparency was not observed from the teacher side. Few professors explicitly stated their generative AI policies or explained how students work with generative AI will be defined and judged in the grading process. So you might see some double standards here. And this one-way transparency was viewed as a surveillance mechanism that reinforced top-down control and a power imbalance between students and teachers. Now here are some recommendations put forth in the article that the communication of generative AI policies and guidelines should move from a punitive approach to a more supportive and inclusive one. Framing AI declaration should be used as a self-reflection opportunity rather than monitoring. And it should be made clear to students that these measures do not aim to catch them in misconduct, but are important pathways towards achieving a consensus on ethical AI use. Next slide, please. So in this slide, I just wanted to highlight the capabilities of large language models to generate images from text. The top row are images created by Midjourney. The bottom row shows outputs from DALL-E, and both are from early 2023. So as you can see, the DALL-E images at the bottom are not so refined yet at this time. Next slide, please. And these ones are generated using DALL-E again in December 2023. I created my holiday cards with AI. And as you can see, the quality of the images has significantly improved, demonstrating advancement in the capabilities of large language models over time. Next slide, please. So we cannot really ignore the potential bias in AI-generated content, whether it's text or image or video. Here you see examples of how AI-generated images, especially the ones on the left, from Midjourney show cultural inaccuracies and bias. These two went viral, you might have seen them. So AI images of what Barbie would look like in every country in the world show that South Sudanese Barbie holding a rifle, and the Qatar Barbie wearing a gutra, which is a traditional headdress for men in the Middle East. And on the right, it's actually, I used DALL-E to generate a logo commercial for a kimchi cookie, just for fun, which has a Japanese flag on it. And we know that kimchi is a traditional Korean food. And this is from April 27, 2024. Next slide, please. So with the rise of AI-generated content in the digital space, there's also an increase in the potential for misuse, misinformation, and disinformation. Probably you have come across the AI-generated picture of the Pope wearing a Balenciaga puffer jacket. or see news about entire Instagram accounts of fake people. Some people are creating AI-generated videos of fake doctors giving advice about nutrition and mental health. And interestingly, a study published in the US journal JAMA Internal Medicine revealed Australian researchers were able to generate more than 100 blog posts, testimonials, and videos of vaccine and vaping disinformation in less than an hour, sounding the alarm for stronger industry accountability. They also pointed out that large language models lack sufficient safeguards for fact-checking health information before it's generated. While models like ChatGPT have some safeguards against responding to prompts about illegal or harmful activities, like purchasing illicit drugs, these measures can be easily circumvented. Next slide, please. So there are numerous tip sheets or cheat sheets available on prompt engineering. The field has grown to include new job opportunities for prompt engineers. I'll share some effective techniques and personal insight on writing prompts that have worked for me. So keep your prompts specific, describe your goal and context, ask ChatGPT to play a specific role or persona, and ask what problem it should tackle. So for example, you can say, you are the nursing instructor for a lab course and you want to develop a rubric for a head-to-toe assessment assignment. You are a patient care manager of a large hospital and want to develop some KPIs for your next project. Or you are a frontline nurse and want to explain the pathophysiology of asthma to a 5-year-old. These are the roles that ChatGPT can really play well. You can try different prompting styles, ask direct questions, open-ended questions, request a list, summary, table, like the one that Laura mentioned. I have seen examples when the model tells you that it's not able to do something and you give it a pep talk, like, no, you can do it. I have faith in you. I've seen you do it. It works, and it starts to circumvent that barrier and generate something. Another technique is chain of thought prompting. This one works well when you have a complex inquiry and you don't want AI to miss any information and respond in a systematic and structured way. So you can tell ChatGPT to take a deep breath and describe it step by step, and it works much better. I personally don't like the word prompt engineering, and I think it should be called prompt management. And the reason is that engineering seeks to create systems that operate predictably and uniformly based on technical precision and repeatability. And that's not how large language models function. If you give AI the same prompt 3 times, you are likely to get different responses each time. Whereas management is about adapting to and navigating ever-changing scenarios, requiring flexibility and ongoing decision-making. So the bottom line, what I'm trying to say is that focus should be on managing AI rather than trying to write the perfect prompt. Next slide, please. Which brings me to my final slides. Ethan Mollick is a professor at Wharton University, Pennsylvania. I've been following his work for the past year, and he does a lot of experiments with AI and large language models. And he raised the notion of anthropomorphism of AI. Anthropomorphism is when we attribute human qualities to non-human things, like objects, animals, or phenomena. We do this often, like Thomas the Train, or if we see faces and people in the sky. And we do this to make sense and relate to the complex world around us and to better understand and connect with them. And this process simplifies complex behaviors or unfamiliar phenomena like AI and large language models that are highly probabilistic and unpredictable. So in a lot of ways, working with AI does not feel like working with a software machine, because machines are predictable. They produce the same results over and over again using the same input. In a lot of ways, working with AI feels like working with a human who needs some direction. It excels at tasks like writing, ideation, faking empathy, and it struggles with tasks like task that machines typically are good at, like repeating a process consistently. It hallucinates and makes stuff up, then it lies and apologizes. Different models have different personalities. Like Gemini is a bit of a planner. Claude 3 is more willing to pretend to have emotions. And this is very human-like behavior. So I'll just conclude with a reflective question for you all to consider on your own time. You don't need to answer it right now, but feel free to put it in the chat or the Q&A, any comments. Do you think this is intentional? Will this assumption of AI being like a human will lead us to disclose more personal information with these machines, not realizing that we are actually sharing them with corporations? And thank you. I'll just pass it on to the next presenter, or there might be a break time at this point.
Thank you, Reza. I think we're just gonna power through. I hope this is fun with everyone. It's Friday. We don't want to keep you too long. So, Dr. Shona, please.
Thank you. In this next section, we're going to explore potential ways that generative AI can be used in clinical practice education. But before we do, I'm just going to put up the next poll. Lois? And if everyone can just take a moment to answer the 2 questions that you can scroll down to. I'll just give you a few more seconds here to answer the questions. It looks like responses are slowing. Okay, so we can probably close the poll. And so as we look at the results, it looks like the majority have not used ChatGPT for clinical practice preparation. And that is pretty understandable given how early days this is with it, as well as the different controversies that are happening with it. A lot of the concerns are around potential of misuse or reliability. Some feel uncomfortable with it and they prefer more traditional learning methods. Others look at using it and depending upon the context, so uses within clinical classrooms or labs. Others feel it is a great opportunity to reinforce learning if risks are mitigated. And others are looking at just the benefits of really using it to level the playing field and really help to support and augment the critical thinking. So we do have some great responses here. And if we can just go to the next slide, please. So when we look at the use of ChatGPT or the large language models, there are a lot of benefits and strengths that we can use when we look at the use within labs, simulation experiences, as well as clinical education. For example, students can use ChatGPT to really gain experience in preparation for their clinical experience. Their clinical shift the next day could be used in preparation for a simulation experience within the educational setting. It can also be used in lab. And where this is and why this is a safe environment is they are truly just chatting with ChatGPT. The information is not going to go anywhere. It's just used to more support and augment their learning. Because with prompts, what we can do is we can start to scaffold that information as both Laura and Abdulreza were presenting, in which we can continue to ask prompts, we can ask ChatGPT for feedback. So it really helps to personalize our learning. Because again, what we're doing is we can really explore those areas that we're having difficulty understanding with, as well as ask ChatGPT for feedback. So it can give the positive feedback, it can let the learner know, where did I go wrong? What should I have done at this particular step? and what should I do next time? It can also be used for tutoring in relation to clinical preparation. It could be used to look at how to do different skills and procedures. It could help with medication research, can help with drug calculations and preparation for different clinical experiences. It could also give them assistance with respect to charting. So how do I chart a certain procedure or a certain assessment? It can develop care plans, as we were looking at earlier. It can give the outline of different clinical skills. It could help with learning the pathophysiology of different medical conditions. And it can also support the students' learning in relation to how to provide patient education. A lot of the research is showing is that ChatGPT is more empathetic than a lot of people. So it can really be used to help to tailor to that patient's level of understanding and where they're at with that disease process. However, as we have been looking so far within our previous slides, is that there are potentials for misuse. These really come down to concerns from educators with respect to academic integrity. There are concerns about violating intellectual property. If we look at, say, the slides, and we're looking at the pictures before, and taking pictures and artwork from actual humans and not taking that responsibility for citing that work. However, what we do know is that ChatGPT is not a substitute for medical professionals. The information that we are given is just truly that generative AI. It's going to develop a response that will sound very human-like. It will sound like it understands what it's doing. But what students really need to know and understand is that they have to go back to those textbooks, go back to the drug handbooks, go back to their clinical practice guidelines, and really see, is this what I should be doing? And so that clinical decision really needs to be made with qualified professionals. There's also issues around the data privacy. If students were to start to put in specific patient information so that they can really develop that care plan, for example, that could raise concerns because, again, this information could be given to different corporations. There's also concerns in relation to bias and accuracy because, again, how ChatGPT and other large language models have been trained is where did they get the information from and how accurate is that information? Because what we're finding is that it doesn't necessarily represent all opinions on different subjects. Next slide, please. And so what this gives us is an opportunity to really start this discussion with students so that we can start to learn how to critically assess the validity as well as that accuracy of that output is coming forward. And so help to prepare them for working in this new clinical environment in which that they will be working in. It also presents opportunities to really explore those ethical, privacy, and legal implications of using these large language models when we start to make clinical decisions. And so things that we need to start to consider is if we're using this technology, who is liable for the decisions that have been made by these large language models? Is it us? Well, it should come down to us, that human, but who's responsible for it as we're starting to look at, say, even the uses of chatbots? What happens if a clinical decision contributes to some kind of treatment error? Again, right, that liability. And what should we be documented in relation to the use for this within clinical practice? And so all of these are really important because, again, as we know, students will be learning and working in a new practice environment. The medical profession is already using large language models to help with patient summaries, to look at different lab and diagnostic tests to determine treatment plans. And so we know that this is already being used. So we need to introduce them to the pitfalls as well as the benefits, and so that they can start being really critical in relation to the use. If you could please advance to the next slide, Minal. For educators as well, it really is important that we start to learn together so that we start working together and sharing our experiences, very similar to what we've been doing today. I think it's important that we continue to learn together as well, given us opportunities to really develop our competency within this area. As Laura was talking about before, we can use this to assist with our workload. So it can start to generate NCLEX style questions. Again, the questions might not be perfect, but it gives you a starting place to work from that you can start to bring into your program and into your classes. It can also help to generate ideas for specific case studies. And it can also really help you to kind of use this opportunity to evaluate the output. And so that you can look at these analytical abilities of these students to see if they're actually using this appropriately. And again, preparing them for this new world. Next slide, please. But again, other things that educators really do need to be aware about, again, are these black box system challenges. And so what this relates to is the type of information that the GPT has been trained upon. It gives us opportunities as well to develop our own GPTs. As we've been looking at ChatGPT 4, we can actually develop our own GPT. So if you have written a textbook on a specific area, you can actually upload that into GPT, and your students could use that specific GPT to kind of explore the data. And so when we're looking at the black box, again, issues around not only how it was trained, but how it's making the decisions as to what type of treatment decisions that it is actually providing is kind of the challenge with this. And so again, this is going to take some time for us to really figure out, because again, with proprietary information, we don't really know what is it being trained on and how is it making these decisions to give us those, say, treatment outcomes. And next slide, please. So when we're looking at the potential prompts, and Aldereza had introduced you to a variety of prompts, it is important, if you're just starting out, keep the prompts as basic as possible. You'll see that these are just basic prompts. So for example, you can ask it to develop a nursing plan for a patient with a specific diagnosis in a specific situation. You can develop a discharge care plan for a patient again. For, say, a specific diagnosis. You can ask it to do drug calculations. It can also find resources for patients, say with a specific diagnosis. And generally what will come up will be community resources, support groups that can be available within the area. So if students are unaware of what is available within the community, this could be a good starting point for them. It can also help with charting. And so again, you just state the procedure that you'd like it to do, and it'll write out the charting for you. However, students do need to be cautioned about using it to interpret their lab and diagnostic tests if they're doing this for clinical prep. In a recent study by Yang, it showed that out of 65 lab and diagnostic tests that was given, only 51% were actually correct, 23% were partially correct, 17% were totally incorrect, and 9% gave completely irrelevant results. Next slide, please. So for the examples that I'm about to provide, I did use ChatGPT Plus, otherwise known as ChatGPT 4. Again, as Manal was talking about before, it is more advanced and does produce more useful responses. What is nice about ChatGPT 4, as Aldereza was talking about, is it does have additional plugins, and these plugins some of them come at a cost, but what they do provide is additional ways of incorporating videos, audio. You can do it for different types of coding. It can actually start to look and analyzing different things, which we'll look in just a second. And so if we take Laura's question before about Queen Elizabeth's funeral, ChatGPT 4 will actually know the date that it happened and give you information about the state funeral, that it was held at Westminster Abbey following her passing on September 8th of 2022. So it is more up to date and current, but that does not mean that we can necessarily trust these results. Next slide, please. So one of the plugins that is actually, I would have to say, kind of interesting is that you can start to use these to do lit searches. So if you're teaching a research class, or maybe you're teaching graduate students in a master's class in which they have to do research, there are plugins that you can use that will start to search for academic papers. For example, some of them will actually provide the PDFs for you. You can start to work through the development of, say, PICO questions. And so you can actually start to look at this to narrow down your question. Some of them will actually review the articles and give you potential questions to look at, what's missing within the data. It can start to develop summary tables for you as well. And so each of the different plugins will provide different ways of exploring and using the information. ChatGPT 4 also allows you to put in files, and so you can put in cartoons and you can ask it to say, what is this cartoon saying? Or you can put in academic papers and say, can you give me a summary of what this paper means? And so it could help people, again, understand what is happening within that research question. Maybe they have troubles, say, understanding quantitative research, as an example. Next slide, please. And so if we're looking at this and just what I was talking about before, again, for this particular prompt, I asked ChatGPT how to do an abdominal wound packing dressing change. And it told me that it was a critical process that needs to be performed to prevent infection and promote healing. And then it started to give me the specific instructions. So it provided a list of the materials it felt that it was needed. Next slide, please. And then it also provided a step-by-step approach, from everything on to wash your hands, to remove the old dressing, clean the wound, and then how to pack the wound, apply a new dressing over top, telling me to clean up and dispose of all the used materials, and then what I need to monitor. So monitoring for signs and symptoms of infection, and then reporting any concerns to a healthcare professional immediately. It also gave me additional tips as to what to do if I'm concerned about it, right? Contact that healthcare professional. And also some positive reinforcement that it can be daunting, but if it's done effectively, we can help to aid in that healing process. Next slide, please. In this next one, I asked ChatGPT 4, how would you chart that abdominal wound dressing change? And so in this particular response, it gave me a sample charting starting with the date and time. It listed the procedure that was done and then told me what I needed to do to describe that wound with respect to location, size, appearance, exudate, edges, as well as the surrounding skin. It told me that, again, that list of interventions that were taken, as well as patient education that needed to be done, as well as next steps and what to monitor for, told me that I'll need to sign it, and then tips for that effective charting. Next slide, please. In this particular prompt, I asked it to do a drug calculation. In this one, I just asked it to do this calculation. So ondansetron orally 24 milligrams, 1/2 hour before chemotherapy. And the medication was provided as a syrup, 4 milligrams per 5 mils, and how many milliliters was needed to administer the dose. And I asked it to show its calculations. And its response was it just gave me the dose itself, and that if I really wanted to see that analysis to show the calculations, I needed to press on that little symbol there, and then it would actually give me the steps within the process. And then next slide, please. With this one, this was just a nursing care plan that I asked it to develop for a patient undergoing an appendectomy. And it provided me with what I needed to do preoperatively as well as postoperatively. So to obtain the patient's medical history, assess vital signs, assess their pain level, their understanding of the surgery, and any education. It gave me potential nursing diagnoses as well as interventions to provide emotional support, to administer any prescribed medications, encourage the patient to ask questions, make sure that informed consent has been obtained. and prepare them for surgery. Postoperatively, asked me to monitor their vital signs, assess their pain level, assess the surgical incision, monitor bowel sounds, as well as the return of bowel function, and then provided again nursing diagnoses with respect to acute pain, risk for infection, impaired mobility, and risk for fluid volume deficit. Gave me specific interventions as well as evaluation criteria. Next slide, please. In this particular prompt, I asked them to interpret the following ABGs. And so then you can see what was listed there with the pH, PaCO2, PaO2, and HCO3, and it just came up with metabolic acidosis with partial compensation. Next slide, please. So with additional prompts, what you can do is then you can ask them, well, what does this mean? And so then it went into describe what does the pH mean, the PaCO2, right down to the HCO3. It gave me its interpretation as well as its overall opinion with this. And so it did lay it out as well for me there. Next slide, please. And as Alderiza as well as Laura have been talking about, make sure that when you're doing any kind of prompts, you're as specific as possible. So if you do choose to use this for a case study in which you do want them to prepare, or maybe they prepare for themselves, what you want to make sure that you're always including is the context, the task, as well as specifics related to in this particular situation, to limit it to 5 ideas, to not invent sources. You could also ask it to ask you questions. You do have to be careful with that. So when you're asking it for questions, it's best to ask it in the prompt to give a free response question, in which what I'm doing is I'm just answering what is happening within that situation versus a multiple choice question, which you'll generally come up with. And then in the prompt, if you do want the patient scenario to improve, you can give that with it. Or if I do choose the wrong response, then what it could happen is that you can also ask it to worsen the patient's condition. And then at the end, your prompt, you should always also ask it to provide any feedback at the end. And then with that feedback, the student can then question it as to, well, what should I have done here versus what did I actually do? What is that doing to the body? And so it can really help them. And so when you're looking at a case study, be as specific as possible, start playing around with those prompts and get it to that exact detail that you want. One of the people that I'm working with right now is actually exploring this use of the case study to replace or prepare students for OSCE. And so looking at their critical thinking with respect to patient education, that assessment, what are they doing with that assessment, and what are they doing with their different things that are happening within that scenario. Next slide, please. There's also a lot of controversy about citation, and should we be citing our use of ChatGPT? And again, that will come down to what are they using it for? If students are using it to brainstorm ideas for a paper, you might not ask them to cite it, because again, what we're doing is we're just using the tool to help kind of flush out exactly what I want to look at. Maybe I want to use it to develop a PICO question, and from that PICO question, I go forward and I do the research. However, if it is something that they're using, say for an academic paper, what you could do is you could have them provide just what happened within that chat and attach it as part of their paper. If they are going to use it as a citation, again, it should be cited as OpenAI and then the year. And then in the reference page, it'll have OpenAI, the year, ChatGPT, and then what version, and in brackets, large language model. Next slide, please. And Wendy, I'll put it over to you.
Hey, thank you so much, Dr. Davies. So I'm going to be taking us out of the classroom and clinical learning environment into clinical practice. So while I know the focus of our presentation is on ChatGPT, I'm going to share some other tools that can be used. So for the next few minutes, oh, actually, we should probably switch screens, sorry. Switch slide. Thank you. So for the next few minutes, I'm going to be sharing how I use ChatGPT in the development of education tools for emergency department nurses and introduce a few other AI options to highlight that ChatGPT, and the version I used is 3.5, isn't the only option as has already been discussed. So this slide was generated from the AI image generation tool embedded in Canva that I know many of us will be familiar with. And the reason I did that is because I think it's important when you are making clinical decisions about people, their appearance is often a key piece of that. Now, are these images wonderful? Some of them are better than others. So just bringing this forward as it can be something helpful to include in your resources that you don't have to worry about where did that picture exactly come from. About a year ago, I was doing some consulting work with one of the Manitoba Regional Health Authorities and was speaking with one of the facility educators about the importance of ongoing education for nurses who are doing ED triaging. So it was a mix of people who are relatively new and others who had been quite experienced. And what they were finding, the educator, was that not all nurses were consistently doing sufficient exploration of presenting symptoms at triage, and in particular, not applying all of the available modifiers. So in our discussion, they expressed a desire to create some patient scenarios that were a mix of common presentations and some that were less common but critical for timely prescriber involvement to improve patient outcomes. This had been on this educator's to-do list for a really long time, but as a site with limited education staff and significant education needs within the facility, it was unlikely that that was going to happen soon. So much like education, clinical reality is time pressured in so many regards. So this became my first foray into exploring the potential for AI to be used in a clinical, albeit education context. So that afternoon, we identified some key cases. So a neonate with fever, young adult with abdominal pain who was actually an ectopic pregnancy, a middle-aged adult with cough. We came up with a couple, a community-acquired pneumonia and a COPD, and an older adult with facial lesions near the eye, which ended up being herpes zoster, because we'd actually had a couple of cases of those that didn't get triaged correctly, and the list went on. So using a really basic prompt, I entered these patient profile introductions into ChatGPT, and less than 2 minutes later had 10 scenarios that served as a starting point for the educator. The scenarios included patient name, age, chief complaint, past medical history, HPI with vital signs appropriate to the patient situation. It included the assessment findings to be expected by the nurse, a CTAS score, differential diagnoses, and immediate nursing interventions. Great. But with that said, was the information provided all that you wanted to explore? Not entirely. Were the interventions correct? Mostly, but not all, and certainly didn't consider region-specific resources or practice capacity. And were the CTAS scores correct? Not always. So, however, were the scenarios helpful? Absolutely. What would have taken myself or the educator between 5 and 15 minutes per scenario to develop, it took ChatGPT less than a minute to generate the 10. And those really required minor editing to be useful to support nurses to then use them to practice. So for today, I'm sharing the use of the same prompt across a few different AI tools to highlight some of the commonalities and differences that might be helpful as people explore the use of different AI tools that are available. Next slide, please. So for today's presentation, I did use the same prompt across 4 AI tools, all of which were free versions. The prompt that was used was, from the view of a triage nurse in an emergency department, please create a detailed patient scenario to help me practice triaging and assigning a CTAS score. I'd like to test my knowledge of the information to solicit from an older adult patient who has pneumonia and several comorbidities. So as you can see, ChatGPT introduced us to 74-year-old Eleanor Thompson, who presented with a 3-day history of shortness of breath, her multiple comorbidities of COPD, hypertension, CAD, diabetes, MI, and CVA, and provides a really good general history covering onset and progression of the shortness of breath, cough, fever, and associated symptoms, so fatigue and appetite. The vital signs seem reasonable for her presentation and medical history, and the assessment is logical for triage. The additional information is content that would also be captured at triage. So as you can see, it generated 2 CTAS scores in this instance, CTAS 2 and 3 with the rationale. I'm going to leave that part of the conversation and come back to the CTAS scores after we've had a chance to look at the other tools. While I didn't include it, ChatGPT also provided some initial interventions and a disposition plan suggestion. Next slide, please. In Perplexity, it was James Smith was introduced to us, who presents with his wife and has a very similar history to Ms. Thompson from our prior slide. Perplexity goes into more detail on the subjective findings being experienced and what was observed by his wife, which would be part of what you're looking for. Again, vital signs were reasonable given the information in the presentation. And as you can see, there's slightly less detail in the assessment findings of the nurse and additional information such as allergies, travel, medication consistency aren't there. So like ChatGPT, a CTAS score of 2 is assigned, but Perplexity does explain the contributing factors, which was one piece I quite liked. Initial interventions were also provided and have been shown. The thing that I initially liked about Perplexity was that it provided sources to accompany its response. But again, because I'm a little bit skeptical, as I think we all need to be at this point in our adventures with AI, I reviewed those sources and discovered that none were actually related to ED triage or ED care, so they weren't exactly relevant to the situation. So again, caution is necessary. Please don't assume that the references being provided are actually appropriate. Next slide, please. So moving on to Microsoft Copilot, it was being very conscientious of FIA and protected the 78-year-old male's privacy and didn't give us a name. Like the content covered in ChatGPT and Perplexity, it's quite similar in both the subjective and objective information. Where the difference emerges is that Microsoft Copilot produced a scenario that forces the nurse to identify the CTAS score while guiding them with the elements to consider in the presenting complaint, vital signs history, and exam findings. And it prompts the thinking of the nurse towards a higher acuity score, but doesn't suggest or doesn't identify what it is. What I liked is it also encourages that learning tone, encouraging tone, which was unique to Copilot. Next slide, please. And the final tool I looked at was AI chat. And again, that same prompt from the view of the emergency nurse triage department. Please create a detailed patient scenario to help me practice triaging and assign that C-test score because I'd like to test my knowledge. So like Copilot, no name was provided and the subjective objective information is similar. The subjective information here is closest to what was in ChatGPT with the additional information that it referenced and provided additional medication details, but it's less comprehensive on the physical findings as it actually directs the nurse to gather additional information, which includes both the subjective and objective findings. So in this regard, it made this tool the least effective in creating a minor edit ready scenario, which was really the focus of this activity. So while chat doesn't provide the specific information that Microsoft Copilot was in being conscientious of FIA, it does really probably give us the best initial tool to use. So next slide, please, the triage slide. This slide is actually the note generated based on the first client, Ms. Eleanor Thompson from ChatGPT. And I have to say thanks to Lori and Marie from the WRHA Emergency Program for getting me this slide. If you recall, the tools that did assign a score allocated a CTAS 2 or 3 if her vitals had been slightly better according to ChatGPT. And as you can see from the simulated triage note, this patient was actually assigned a CTAS 1 based on the use of the first order respiratory modifier because of her SpO2 being less than 90%. So remember that again, one of the prompts for doing this or the reason for doing this was because we had nurses who weren't applying the modifiers. So that's where this becomes a really important feature of making sure you are doing that focused work on creating that scenario to test that particular piece. So because of that, this patient was identified as a CTAS 1. So while all of these AI tools were helpful with a basic prompt, as has already been identified. Tweaking those prompts or going back and asking additional questions to further modify that work. And you can say to ChatGPT or the others, based on your prior response, please add whatever it is. So I would say, please add neurological symptoms or level of consciousness, because that was one thing that was not super evident in most of them. So you can add those details in to further develop that work. I want to shift us away a little bit from clinical education scenarios and share a few potential applications for AI to make the work of administrators a bit more efficient. I'm sharing these examples because they actually came up in the 4th-year leadership course that I teach. And quite frankly, would have been nice to have at hand as a new administrator, or even later on as I was brainstorming and transforming tools that I did have. So as I said, at the University, sorry, next slide. As I said, at the University of Manitoba, in year 4 leadership, we talk about preparing to be both a good leader and a good follower. And as nurses consider their transition to manager or leader roles, there are often things that will be new, like hiring people, responding to patient complaints, speaking to different groups of people. With this in mind, I asked ChatGPT to respond to a series of prompts. In doing this, I was thinking about it from the lens of an administrator creating an interview guide, but also from a student lens, this would be really helpful to prepare for an interview. As you can see, I have said that I would use the Nurse to Emergency Department Guide to Nurse to Emergency Department position description posted on the Manitoba Health Careers website to create both behavioral-based and clinical-based questions. So again, it took ChatGPT less than a minute to come up with these answers for me, questions and answers actually, whereas writing the actual interview guides took me much longer. And I will say that questions that ChatGPT came up with were questions I have asked new staff. So describe a situation where you had to provide care for a patient with a complex health need. How did you prioritize your care and ensure those needs were addressed? Think about a time where you had to collaborate with other healthcare professionals to provide optimal care. How did you ensure effective communication and coordination with the team? Describe a time where you had to advocate for a patient's needs or rights within the system. How did you ensure the patient received appropriate care and support? So those are just a couple of examples from the behavioral based. And then in the clinically based questions, again, using an emergency department setting, it asked the individual to speak to chest pain. Tell me your actions if you had a patient arriving complaining of severe chest pain radiating to the left arm and jaw with diaphoresis. Vital signs are stable. EKG shows ST segment elevation. What actions would you take? Another example was sepsis or DKA. So the questions it came up with were completely appropriate to the setting that I had asked it to consider. The next example I looked at was in responding to patient complaint letters. In one of my first administrative roles, I had worked in an environment that didn't have a patient relations office. So that was something that I did directly with not a lot of experience. By taking a sample letter and plugging it into ChatGPT, it gave me a response that acted as a really good foundation to start that letter. It wouldn't be exactly what I would use, but it was a good start. The next piece that I did was then take that language and adapt it for the level that the sender would have put it in. Because sometimes our tone of language or our use of words don't necessarily match that of the person who's going to be receiving it. And the final thing that I had done was take a diabetes example right out of the diabetes website and take medical information and adapt it to 2 different target audiences. Because sometimes, again, in administrative or education roles in the clinical world, you have to do that, and that language might not be as comfortable. So that's sort of my suggestions for opportunities going forward in practice and administration practice particularly. And while there's much more in terms of how can we use these tools in terms of looking at client information and outcomes, that's a whole other conversation. So back to you, Dr. Kleeb, please.
Thank you very much, Wendy. And thank you, Dr. Shona and Dr. Laura and Abdulreza. It's been really informative discussion and application of the different ways we could use ChatGPT. And we know we gave you a lot to think about and reflect on. And we know that there probably are some questions that you would like to ask of us. So feel free to post your question in the Q&A, and we would be happy to respond to those. And there is a poll actually that just popped up, I forgot about, and that is just to get a sense of some of the concerns around ChatGPT. Thanks, Luz. So we're getting some responses. So responses are coming in, slowing. So I'm gonna give it another 10 seconds and end the poll. Okay, let's just see what the responses are. So academic dishonesty, huge. Accuracy of information, hallucination, that's very good. And staying current, of course, like it's a steep learning curve and you think that you know, but unfortunately, like you need to learn. So that's something that will keep coming back to us. Thank you all for sharing your thoughts. So, Luis, will you be helping us with the questions? And there are two participants who have raised hands, which I cannot see. If you wanna maybe walk us through those, please. And I'm gonna maybe, draw on you on that because, go ahead.
Someone just posted a question on the Q&A, so I'll read that out. Presenters have been answering the questions as they've been coming in, so that's really good. The question that Lori posed is, the content seemed focused on medical, surgical, nursing. Can you please speak to examples of generation for communication, therapeutic communication, or counseling?
So I can speak to that a little bit in terms of one of the open AI applications. OSCE GPT has actually been used, or Manitoba's experimenting with OSCE GPT in terms of using it to have challenging conversations. So you would put in your scenario and your student would speak to it and get responses based on what you've given the OSCE GPT to work through, but it is very much about that communication piece in that particular application. Or at least that's how Manitoba's been using it so far.
And they set up
before we go on to the next question, and I think sometimes if you would like to even try with ChatGPT and ask them and tell them, could you provide me examples for how I can, educate maybe a group of professionals around communication, or how can I maybe do that around therapeutic communication, and just see what responses they provide to you, and then kind of begin critiquing that and see, because it does help and give some structure, just kind of gets you thinking around certain dimensions, especially in the older version one. Let's go to the next one.
Oh, sorry, before you go on to the next one, I just want to add in just one consideration, is that the large language models have been primarily trained on English language resources. And so if you go to another language, it may not be correct. And so you may get more of that hallucination.
Oh. Louise?
For the next question, so this person says, this one is for Laura. So Dudette says, what are your expectations for students giving their answers to discussion questions in class, given that ChatGPT may give details that they may not know? Are you expected to learn all that details, and will they be tested on that information that's generated from ChatGPT?
Yeah,
That's a
thanks
good
for your
point.
question, and I hope that I'm answering it. I had a chance to read it ahead of time as well. So I think really what it comes down to is teaching philosophy, and whether it's, you know, a formative or a summative assessment. Ultimately, I think course design obviously includes both, and there still are closed book exams in the courses that I teach where they're not able to access that. So at the beginning, you know, there are those conversations around accountability for your own learning. If a student, you know, is just regurgitating information that they don't fully understand, that's going to come out in different ways in the course. And my mind is going back to the concept map example, where I haven't really dived too deep into it yet, but I'm imagining how I would use it in class. And probably what we would do is have it generate the concept map, and then students take it, and that becomes a closed book activity where then they're not using the GPT model to dive deeper and expand that out. So I really think it's, you know, how assessments are designed. And even I know in online teaching courses there is a lot of that reflective piece where they can't use the GPT model to generate those personal lived experiences. So I always kind of think back to how am I designing the assessment in the first place if I want to either encourage that use or limit that use. So I hope I'm answering your questions. Again, just drawing on your piece here about giving details they may not know. I think that goes back to the broader responsibility and accountability of a nursing student, and the way that we teach that if you find an answer you don't know, you go to a credible source to find that. And that in our curriculum, broadly speaking, we're teaching students what a credible resource is, how to find it, how to decide if it's credible, and then moving forward in that way. So kind of bringing in a few different threaded concepts in all of our teaching.
Yeah, thank you, Laura. And Shauna also is typing a few more points in response to the question by Dudette. I don't see other questions. Louise, are there other questions?
So no, not at this time. There aren't any other questions. I can post up the last poll if we feel the time's right.
Yes, let's do the poll, and then we will go to a couple of slides just with information sharing.
Throughout the presentation, as people were putting questions in the Q&A, we were typing answers. So you can see those answered questions by clicking that tab if everyone didn't have a chance, just to kind of follow that conversation and responses.
Thank you, Laura. And responses are coming in for the poll. Hopefully we have created some curiosity today and engagement, and people will feel motivated to take this learning further to the next step. A few more seconds. So I'm going to end the poll and display the results. So moving forward, I'm interested in exploring this in my practice, and the answer for the majority, 91% said yes. So that is really very encouraging, and we really appreciated your engagement in this webinar, and we believe this is kind of really the starting point to begin developing that knowledge and comfort level in using AI or large language models applications such as the ChatGPT and the different applications we kind of showcased today. But really, it's continued learning, and here we wanted just to offer some suggestions for continuing the learning and the conversation in this space. We have Dr. Richard Booth will be presenting on the evolving intersections of technology and nursing preparing for an augmented future on May 23rd. And to register for this presentation, the link and the registration information on the Kazan webpage. We also invite nurse educators to consider joining our digital health interest group. These groups for nurse educator are part of Kazan, and all of us today who shared our information with you, our knowledge with you, are members of the digital health interest group, and we hope to connect with you in that context or in any other like context in the future. So I'm just looking if there are any more questions coming in. We also encourage you to continue reflecting on this topic. And, the questions are more than the answers, and there is no one correct answer. As I said, maybe the uncertainty and the absence of policy and regulation, it's a huge challenge for all professions. So let's keep thinking, let's keep reflecting, let's keep examining those questions, and also create the space, the safe space for our students to come forward with those questions and engage with educators and leaders within our institutions in navigating the complexities of this change. And hopefully we will build capacity as we go, and also kind of achieve responsible use of those technologies in our lives, personal lives and professional lives. Nurses have always adopted this approach in their care. So we need to just continue to support and provide the resources and supports for nurses to develop these new skills. Thank you all for being with us. I'm not seeing any new questions or comments coming in. Happy Nursing Week to all of you, and happy Friday, and happy Mother's Day. Many happy occasions taking place. So enjoy your time. And we are finishing a little early because we did not build in the break, just recognizing it's a Friday and we wanted to just power through. Thank you all. We look forward to seeing you on future presentations. Thank you. Enjoy the rest of the afternoon.
Thank you, everybody. Thank you to our wonderful presenters for the information you've shared today. The presentation was really engaging, so I hope everybody was able to learn something.
Thank you very much for your help, please. We can end the webinar. Thanks.